This week's injury update is brought to you by the Jacksonville Orthopedic Institute. JOI is the official sports medicine provider of the Jacksonville Jaguars.
Dr. Carl Freeman joins us right now from JOI, Jacksonville Orthopedic Institute, and talk a little bit about Cooper Kupp especially, but hamstrings all around the National Football League, and the most recent is Justin Jefferson. Doc, thanks for taking a few minutes here on a Tuesday afternoon. Hope you're doing well, and well, it's good to see Cooper Kupp doing well, I guess, for everybody's fantasy football teams.
Yeah, exactly. Well, thanks for having me. You're exactly right. And wide receiver Justin Jefferson of the Vikings is out now. You saw him clenching his buttocks as he was walked off the field. This is strange because the last couple of years it seems like there's an epidemic.
Yeah, go back to first Cooper Kupp. These injuries around the hamstring, or I guess is hamstring considered basically a soft tissue injury?
Sure. Well, the hamstrings muscle is a very strong muscle. Think of the quadriceps in the front of the leg. That's your major power when you're extending your knee, you're pushing out. People forget that the hamstring is an equally powerful muscle group in the back of the leg, and it connects to your sits bone, kind of like that butt bone you're sitting on. And that's the connection point. This muscle group, just like quadriceps has 4, well, hamstrings has 5. They all come together in this big tendon that you're all sitting on if you're sitting right now. And that tendon unit has to accept all that force of any kind of forceful contraction. Like think about these Think about these wide receivers or these running backs as they're cutting or they're launching themselves. There's a lot of force going through that tendon. So this is definitely a soft tissue injury.
Yeah, and obviously Kupp's coming back from it. Justin Jefferson, it's got to be pretty significant for them to rule already, hey, he's going on injury reserve, going to miss 4 games, and sometimes the best way to get these things to heal instead of being a nagging injury is just to sit down and don't play for a month, right?
Well, that's the initial treatment for sure. These are very painful and they're very debilitating. I've had patients who come in and they're having a hard time just doing prolonged standing, let alone playing football. And it affects you not just standing but sitting and a lot of the movements you make. So these are very painful, deep buttock pains that people feel. And, exactly, just like you said, initial treatment, rest, get them out of the sport, kind of stop the repetitive activities, NSAIDs, ice, those type of things are our first line right away.
Dr. Carl Freeman with us, Jacksonville Orthopedic Institute, Brent and Friends on ESPN 690. From a playing standpoint, especially in football, which is a violent game, and these guys play with pain all the time, I got to believe, although you just mentioned how painful they can be, as you're getting back and getting closer, you're like, hey, I'm there. Like, I feel good. And then you're like, yeah, but one little tug or coming back a bit too early, you can do it again. I mean, I'm sure that's what they were wrestling with a guy like Cooper Kupp who did come back.
Yeah, and we've seen that in the past here in Jacksonville and around the NFL and other sports where these athletes will think that we've rehabbed the hamstrings well enough, and they'll try and come back, and then what do you know? They're out again with that high hamstring. It's a very challenging injury to recuperate.
Well, you obviously specialize in this. The hamstring, you mentioned it. It's associated with so many other things in your leg. A weak hamstring can cause a lot of problems in other parts of the leg, right?
It can. The hamstrings goes all the way down to across the knee. But the reason that I focus on the higher hamstring injuries is because I'm a hip specialist, and so it kind of falls into my bucket, even though it's not truly the hip. It's kind of near the hip, so I guess it falls into my neighborhood. So one of the things that we're doing nowadays on these is if we can't get them to recuperate with the injections, with the physical therapy, with the laser, and we even have shockwave therapy now, all these things we throw at it, if we can't get those things to get it done, then we'll go in with a scope and repair it.
Give us an idea of, normal us, like not a pro athlete, hamstring injury, and then obviously big-time athlete, fine-tuned engine injuries where whether you treat them differently or you also have to be more careful with one versus the other.
Yeah, that's a good question. Basically there's 2 groups of these types of injuries, and the first is when you pull that hamstring all the way off. This is a complete tendon rupture where the tendon is no longer attached to the bone. The times I've seen these are when people accidentally do the splits, like on a wet floor, or some of the athletes sometimes will accidentally do a splits. A lot of times that is the mechanism that causes these high hamstrings ruptures, and those almost always need to be treated with suture, tacked down with anchors, just like we do with rotator cuffs and a lot of other tendons that rupture and have to be repaired. So that's kind of the first group. And it doesn't matter whether you're a pro athlete or a weekend warrior, everyone gets treated the same in that one. The more difficult one to treat, and the one that has had such a revolution over the last few years, is these partial tears, and they tend to be undersurface tears. So kind of like the very terminal end of the tendon is still connected, but the whole broad footprint that tendon is supposed to be attached on has come off, and it tends to fill with a little bit of fluid in there and be painful and aching, hurt to sit, hurt to use your hamstrings to do things like walk or exercise, etc. And those we've had a kind of a little bit of a revolution in treatment, whereas a few years ago we just would have said rest it, try some anti-inflammatories, physical therapy, that kind of thing. Nowadays we're doing those still. Those are definitely still the first line, but then now we have a whole set of PRP injections. Some people are using stem cells in these, and then we're even doing repairs now on the partial tears, which is kind of a new surgery that we're doing.
Dr. Carl Freeman with us, Brent and Friends on ESPN 690. Dr. Freeman at Jacksonville Orthopedic Institute, JOI, joins us weekly here to talk about some of the injuries around the NFL and maybe even a little bit closer to home if you are experiencing some of these injuries yourself or know a student athlete or somebody else that might be dealing with it. How do you view the hamstring in terms of especially the high-profile athlete injuries? Is it lack of stretching or hydration or just chance? Are some just going to go and you're going to get hurt and you can't really do anything about it?
Well, a lot of these are probably some type of acute on chronic injury where you have a repetitive injury. These are the guys who are getting the massage and all that by the training staff before the game and after the game, and then all of a sudden they finally get that acute event, that lunge, that cut that finally overloads that tendon and it breaks. But, some of them are just, brand new injuries, chance, bad luck.
Yeah, and that makes sense. I'm always fascinated. These guys are in such good shape, yet that finely tuned engine, it doesn't take much to put them on the shelf for a month like a guy like Justin Jefferson, right? You're
right. Yeah, you're right. Poor Jefferson.
Dr. Carl Freeman, thanks for giving us some insight on Jefferson, Cooper Kupp, and the hamstring injuries. We know they're pretty prevalent in sports. Appreciate you joining us for a few minutes.
Yeah, thank you for having me.
You bet. Dr. Carl Freeman from Jacksonville Orthopedic Institute, and you can visit him if you have any hamstring or hip injuries in the San Marco location for JOI. When we come back, Ken Shamrock